Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh. I am Dr. Umi Molisi. Okay, for today MOOCs, I will talk about what is the difference between the arterial and venous thrombosis. There is a few parameters that we can look at to know and to differentiate between the venous thrombosis and arterial thrombosis. First, we go to the blood vessels. Okay, for the arterial thrombosis, it might be involved in the arterial artery. Okay, so it can have in the coronary arteries, cerebral arteries, and also aorta. For the venous thrombosis, usually it occur in the superficial varicose vein and also deep leg veins. Okay, you can see there is a morphology differences between this arterial thrombosis and venous thrombosis. This one we will talk later in the differences in terms of morphology, and you can see this is the Langhilem thrombosis. The second parameters we look at the risk factors. In the arterial thrombosis, the risk factor is due to the atheroma. So you can see this is the different degrees of atherosclerosis. Okay, in the mild type, you can see the fatty streaks. In the severe atherosclerosis, okay, there is ulcerated plaques, and in the severe atherosclerosis, they will develop the aneurysms. For the venous thrombosis, the risk factors is immobility. The patient might be prolonged bedriddens for due to the fractures, any trauma or post surgeries. Okay, for the third parameters is a pathogenesis. As I mentioned before, in the arterial thrombosis, the pathogenesis is due to the turbulent blood flow and endothelial injury. Okay, you can see this is the normal blood vessels, okay, with a laminar flow, and if there is a obstructions because of the atherosclerotic plaques, okay, so the blood flow will change from the laminar flow to the turbulent flow because it's a high shear flow. Okay, this turbulent flow can cause the endothelial injuries. In the venous thrombosis, okay, due to the hypercoagulability and blood stasis. Okay, example in the varicose veins. Okay, because of the varicose vein, the blood vessels is static in the lower limbs, so it can leads to the venous thrombosis. Symptom for the arterial thrombosis usually is occur sudden onset, while venous thrombosis is a slow onset. For the complications, okay, for the arterial thrombosis, it can lead to the tissue infarctions, and also if the emboli, it can cause the arterial embolism. Okay, if the emboli to the brain and cause the brain infarction, so it will lead to the stroke. And also this is an example of the myocardial infarction, so where there is a thrombus in the coronary arteries and block the coronary artery and leads to the myocardial infarctions. In the venous thrombosis, okay, it start in the deep leg veins, so it can emboli or it can go to the pulmonary circulations and cause the pulmonary embolisms. So you can see the thromboembolism lodged in the pulmonary artery and its branches. Okay, for the sixth parameter is a propagations. Okay, in the arterial thrombosis, the thrombus will build up again or retrograde directions to the blood flow. While in the venous thrombosis, it will extend in the directions of the blood flow, because in the venous, usually there is a injab or waft at the venous circulation, so it will extend to the direction of the blood flow. And number 7 is a morphology. Okay, both in the arterial thrombosis and also venous thrombosis, this is the antemortem changes. So the antemortem changes, you can see the lines of Zant. Okay, in the arterial thrombosis, there is a gray-white variable with a line of Zant. Okay, line of Zant, you can see the alternating between the red cell mesh with the platelet and fibrin in the white colors. Okay, it will alternate between these red cells and also platelet and fibrins. This is histologically what we call as the lines of Zants. You can see the gross morphology, okay, to see the line of Zants also. Okay, so for the arterial thrombosis, it's because of the meshwork of platelet and fibrins, so you can see the gray-white variable with line of Zants. Okay, this is the totally occluding the lumen in the arterial thrombosis. While in the venous thrombosis, you can see the gelatinous red in colors. Okay, gelatinous red in colors. And histologically, you can see the line of Zant. Even in the gross, you can see the line of Zant, but it's not obvious as in the arterial thrombosis. Okay, so this is the gelatinous red in colors, okay, for the venous thrombosis, and you can see line of Zant, but more to the meshwork of the red blood cells. Okay, the last one, detachments. Okay, in the arterial thrombosis, is involve entire or almost entire thrombus to create the embolus. Okay, arterial thrombosis occur in the high shear flow, and the platelet-rich thrombi are formed around the ruptured atherosclerosis plaque, and it will damage the endothelium. Because high shear flow, the almost entire of thrombus will go for emboli to the other place. Okay, while in the venous thrombosis, okay, venous thrombosis is occur in the low shear flow, so mostly around the intact endothelium wall. Okay, fibrin, venous thrombi are fibrin rich, encapsulated around the red blood cells, and it only tail fragment of thrombus to create embolus. So this is the summary how to differentiate between the arterial and venous thrombosis. So you can look at the vessels, risk factors, pathogenesis, symptoms, complications, propagations, morphology, and also detachment of the thrombus. Okay, I think that's all. We will see you again in the next video. Thank you very much.